Welcome to Science, Health and Healing Encyclopedia of Children's Health Core and Ali Academy. I'm Dr. Majid Ali. The subject of this article is Paradoxical Insulin Response, Part 4, Gardner's Thinking. In my clinical work, sometimes I think like a surgeon. If I have to advise a patient not to have surgery or to have surgery, I think like a surgeon. Back in 1967-68 winter, I received my certification in surgery and became a fellow of the Royal College of Surgeons of England. Sometimes for my patients, I think like a pathologist. For 29 years, I was a hospital pathologist, running a major laboratory and diagnosing diseases all day long. I think as a pathologist primarily when I see a patient who either has recognized documented cancer or I suspect that there may be cancer. For all other chronic problems, I actually think like a gardener. There is another video article, The Gardener. Please watch that. In the Gardner model, the bowel, blood, and liver represent the unit of the soil and the roots. Thyroid, adrenal, pancreas, the branches, neurotransmitter hormone, your face, your skin, your hair, neurotransmitter hormones, they're like flowers and leaves, and sunshine represents spiritual and ethical equilibrium. Now in this series on paradoxical insulin response, a term that I coined to make an important point about seemingly paradoxical insulin responses in the early stages of the program. In part 1, part 2, and part 3 of this series, I describe what it is. I present a case and give you reasons why it can be seemingly contradictory to what we expect. Now in this part 4, I want to use this case as an example to make an important point. In integrative model, when you're thinking of restoring the ecologic systems in the body, the bowel flora, the stomach flora, the flora of the oral cavity, detox of the bowel, detox of the liver, blood cleansing, slowing down the heart, you have to think like a gardener. You seed it, feed it, weed it, and then wait for the sunshine. The commonest frustration that I see in my clinical work with chronically ill patients, they expect that the years and years of the toxicity in their bowel, blood, liver, brain, kidneys is just going to disappear because they have heard somebody promise a cure in 3 weeks or 4 weeks. I personally am not very comfortable sometimes when I see dramatic immediate results in cases of chronic illness. Now, in this paradoxical insulin response, I describe a case in part 2 and then give you explanation of part 3. My point is, initially be prepared that if your program of healing is sound, based on sound principles, scientific principles, and implemented by an experienced integrative physicians, you are going to heal with some rises and some falls. A rise would be improvement in clinical results, celebrate yourself. But when there is a fall, don't be too hard on yourself. Sometimes you can understand why there is deterioration. There may be a virus infection, there may be too much toxicity, as happens when you see a paradoxical insulin response, when initially insulin blood values, rather than go down as you expect, of course that's the purpose of insulin reduction program, they begin to rise. In the case that I presented in part 2 of this series, the peak insulin value of this woman with fatty change of the liver was 71.3, about 3 times as much as it ought to be. And then 9 weeks later, when she lost 6 weeks in weight, she is feeling much better. Symptoms of gastritis, irritable bowel cleared up. She's not tired. But when we did the insulin at the end of 2 hours, it was 101, which is 30% increase in insulin when you expect a drop in insulin. And that's when I decided to introduce the term paradoxical insulin response. And I decided to do this series. But my point not only is to show you what happens when you have fatty change of the liver, but make a larger point. When you want to heal with natural ways, prepare yourself for some phases of improvements and some setbacks. You know, there's an ancient saying that in life it's not about how you fall, it's how you rise up again. So over and over again, I tell my patients that be prepared when you're feeling better, celebrate yourself. When you have a seeming setback, you can't always figure out. Healing is a harmonic process. So you're going to heal with some rises and also with some falls. Please forward this YouTube segment to your contacts. Our vision at the core is to provide authentic information free of cost, free of corporate deceptions, and free of ideological distortions. Visit kids123.org if you want to know how you can participate in our effort. Thank you for joining me. Thank you so much.